If there's a medication that causes less pain with a tummy tuck, why aren't we all using it? It takes time, energy, and money to deliver a result with less pain. And these are three things that no surgeon wants to spend. Why? Because it's already hard enough running your practice, maintaining overhead, doing all those things. Some surgeons are more focused on this than they are on the outcome of the patient and the perioperative management. And I think that's fair. I'm not trying to attack anybody. I think that a lot of surgeons are focused on running their business first. In my practice, I focus on the patient. I say, what's the best thing always for the patient, no matter how much time, energy, and money it costs me? I like to think, what would I want for my sisters or for my mom? And if there's a chance that it's going to make a difference, I'm going to utilize that chance. So EXPAREL costs about $350 to purchase it, to use it in patients. And in the hospitals, a lot of times they won't let you use it. There are alternatives. There's this other medication that people kind of call fake EXPAREL, and surgeons say, oh, I use that, it's just the same. That just shows you that that person is thinking about the dollar. And they're making a decision to cut that corner and to use a slightly less expensive product because they think it's going to give a similar result. But they don't know for sure if it's going to do it or not. So I don't like to think that way. I just like to think, what's the best thing for my patient always? Even if it costs me time, energy, and money and eats into my overhead and makes it so that I'm not making another $100,000 a year, it's totally worth it to me because I sleep like a baby. Okay, I go home, I know that I did everything that I could do for that patient, I sacrificed my time and my energy, and I absorbed the cost of that medication so the patient didn't have to think about it in their consultation. If you let the patient decide if they want it or not, some will pick not to have it, and then their result, their outcome is not the same. Their experience is not the same. I want all patients to be able to have the least amount of pain possible. That's why I choose to use this medication and the other medications, and that's why I've spent years trying to perfect these techniques, combining all of the data and information and science behind early recovery protocols with anti-inflammatory medications, NSAIDs, gabapentin, along with short-acting and long-acting injectable medications and an anatomical approach to their injection and timing so that we can give the best possible recovery to patients. It's not your mother's tummy tuck. It's something different. I've written countless articles and spent hours and days perfecting this to be able to give my patients a different experience, one that has less pain and no drains.